With recent talks about psychedelics and addiction medicines from the Whitehouse, how about cancer? Hi there, my name is Dr. Walter Lemo, naturopathic physician with a practice solely focused in cancer care for over 20 years and in clinical practice for 27 years. So over the weekend, the famous podcaster Joe Rogan was in the White House with President Trump, creating awareness on psychedelics, and in particular Ibogaine in addiction medicine, because there's been some preliminary data in there. And so what it did for me, it made me reflect about the subject of psychedelics in cancer, because you don't think there's post-traumatic stress disorder in oncology. Of course there is. It's one of the only fields in medicine that literally tries to define your lifespan, and everyone knows someone who's passed away from cancer of all ages. So it's definitely a world that could be quite potentially useful in cancer, to help people unlock them, to help them heal. While Ibogaine is one agent, it's got its risks. It's got cardiac risks, and but there's a whole world of others. And so I've definitely have had patients have patients on their own accord who've been exploring these like underground, that really reported that it's helped them, and helped them to kind of heal, to improve their quality of life, to help some with pain. And yet, here they're doing this all underground. So I think, Canada and British Columbia could take some lessons from this more open above ground discussions of some psychedelics period, and potential applications in cancer care, that there could be some creative means of so patients could access these above ground, and they could all be monitored safely.